Forget the dramatic music. Forget the slow motion walks down the hallway with a perfectly coiffed scrub cap and a brooding stare. Hollywood loves the God complex, the idea that being a surgeon is about being a rock star in a blue gown. But if you're looking for the glamour, you're in the wrong room. The reality of surgery isn't found in the heroic speeches. It's found in the quiet, gritty moments that happen when the cameras are off. It's found in the smell of burnt flesh that lingers in your nostrils long after you've showered. It's in the sharp, stabbing pain in your lower back after standing for 9 hours without a bathroom break. It's in the crushing silence of a car ride home at 4 a.m. after you've lost a patient, knowing you have to be back in 4 hours to do a routine gallbladder removal like nothing happened. People see the save, but they never see the cost. They see the title, but they don't see the person underneath the lead apron, slowly being worn down by the sheer weight of what it means to cut into another human being. If you're thinking about this career, or if you've ever wondered what really happens once the anesthesia kicks in and the doors swing shut, let's talk. Not about the textbooks, but about the things no one tells you. Let's start with the stuff your anatomy professor didn't mention. Most people think surgery is a mental game. It is, but it's also an endurance sport. Imagine standing in one spot, exactly one spot, for 10 hours. You can't lean, you can't sit. You are draped in a heavy, sterile gown, and if you're doing vascular or ortho work, you're wearing an extra 15 pounds of lead underneath to protect yourself from x-rays. Your neck is craned at a 45-degree angle, peering into a hole the size of a coin. This is why surgeons have bad backs by age 40. Your body becomes a statue while your hands perform micro movements. Then there's the temperature. Operating rooms are kept freezing, usually around 60 to 65 degrees, to keep the equipment from overheating and to curb bacterial growth. But as the lead surgeon, you're sweating. The heat from the massive overhead lights beats down on your head while your feet are numb from the cold floor. It's a bizarre physiological paradox. And then there are the smells. This is the part they can't show on TV. When we use the Bovie, the tool that uses electricity to cut tissue and stop bleeding, it creates smoke. That smoke is literally the smell of cauterized human flesh. It's a heavy, metallic, acrid scent that sticks to your hair and your skin. Or the smell of a GI bleed, or a necrotic limb. These are scents that stay with you. You'll go out to dinner after a long shift, and for a split second, the smell of charred steak will trigger a memory of a trauma case from 3 hours ago. Your sensory map of the world changes. You don't just see patients. You smell the progression of their disease. You hear the rhythmic, mechanical chirp of the ventilator, a sound that becomes the heartbeat of your working life. If that sound stops or changes pitch, your adrenaline spikes before your brain even processes why. You are constantly on, wired to a system of sights and sounds that the rest of the world has the luxury of ignoring. Most people think the hardest part of the physical toll is the lack of sleep. It's not. You can train your brain to function on 4 hours of sleep. What you can't train is the OR freeze. It's that moment mid-surgery where your legs are cramping, your bladder is screaming, and you realize you still have 4 hours of reconstruction left. You have to dissociate from your own physical needs. You learn to suppress hunger, thirst, and the urge to move. You become a vessel for the procedure. It's a strange kind of asceticism. You are a highly trained athlete, but instead of running a marathon, you're performing a symphony in a refrigerator while someone pokes your lower back with a needle. There's a term in surgery that isn't in the manuals: the ghost. Every surgeon has one. The ghost is the patient you couldn't save. The one where you did everything right, every stitch was perfect, every decision was by the book, and they died anyway. Or worse, the one where you made a mistake. That's the reality no one wants to talk about. Surgeons are perfectionists by nature. We have to be. But the human body is unpredictable. When a complication happens, it doesn't stay at the hospital. It follows you home. It sits at the dinner table with you. It keeps you awake at 2 a.m., replaying the what-ifs. What if I had used a different suture? What if I had checked that lab value one more time? But here's the truly difficult part: the emotional whiplash. In any other profession, if you have a catastrophic failure at 10 a.m., your day is over. You go home. You process. In surgery, if you lose a patient on the table at 10 a.m., you have a routine hernia repair scheduled for 10:30 a.m. You have to strip off the bloody gown, wash your hands, take a breath, and walk into the next room with a calm, confident smile. Because that patient deserves a surgeon who is 100% present. They don't care that you just had the worst hour of your life. They need you to be at your best for theirs. This requires a level of compartmentalization that is almost superhuman, but it comes at a price. Over time, that wall you build to protect yourself can become too thick. You start to view people as cases or gallbladders or traumas just to survive the day. Staying human while performing such a mechanical, high-stakes job is the hardest surgery you'll ever perform. If you choose this life, you have to accept that you are entering a time warp. While your friends from college are getting their first promotions, buying houses, and posting photos from weekend getaways, you are still in the basement of a hospital, eating a lukewarm protein bar and wondering if it's Tuesday or Wednesday. This is delayed gratification, taken to its absolute extreme. You don't just lose your 20s, you often lose the ability to relate to people who aren't in medicine. When you finally do go to a normal social gathering, you feel like an alien. Your friends are complaining about a long meeting or a spreadsheet error, and you're sitting there thinking about the fact that you held a human heart in your hand 4 hours ago. The stakes of your world are so much higher that everyday problems start to seem trivial. This creates a profound sense of isolation. You will miss things. You will miss birthdays, anniversaries, and funerals. You will be the one who couldn't make it because an emergency case came in at 4:55 p.m. The hospital is a jealous partner. It demands everything. And even when you are home, you're never truly off. Your phone is always within reach. Your mind is always half calculating the recovery of the patient in bed 12. You spend decades becoming an expert, but by the time you arrive and have the big house in the title, you realize you've spent more time with your scrub tech than your own spouse. It's not just a career choice, it's a lifestyle of perpetual sacrifice. You have to ask yourself, is the trade-off worth it? So why do we do it? If it's freezing, if it smells, if it breaks your back and takes your time, why stay? Because of the fix. There is no feeling in the world that compares to the moment you find the source of the bleeding and stop it. There is a flow state in surgery that is almost spiritual. When the world outside the OR disappears and it's just you, your team, and the anatomy. In those moments, you aren't a person with a bad back or a mountain of debt. You are a craftsman. You see a problem, you use your hands, and you fix it immediately. In medicine, you often wait months to see if a pill works. In surgery, you know the result before you even leave the room. It's the aha moment when a patient who couldn't walk for 6 months stands up the day after surgery. It's the look of pure, unadulterated relief on a mother's face when you tell her that her child is going to be okay. In those seconds, all the missed weddings and the 3 a.m. coffees and the heavy lead aprons vanish. You realize that you have been given the ultimate privilege, the permission to intervene in a human life. People trust you with their lives when they are at their most vulnerable. They go to sleep and let you cut them open, believing you will bring them back. That trust is a heavy burden, yes, but it's also the most powerful fuel on earth. It's not about sacrifice anymore. It's about purpose. You aren't losing your 20s, you are spending them becoming someone who can do what no one else can. Being a surgeon isn't what you see on TV. It's harder, dirtier, and more exhausting than any drama could ever portray. But it's also infinitely more rewarding. If you can hear all of this, the smells, the ghosts, the isolation, and your first thought is still, I want to be in that room, then you might just have what it takes. Medicine is a long road, but you don't have to walk it alone. If you want the truth about what it's really like behind the curtain, hit that subscribe button and join our community. We're pulling back the veil on the medical profession, one honest conversation at a time. To the future surgeons watching this, stay grounded, stay humble, and keep your hands steady. I'll see you in the next one.